Caring for a loved one at the end of life is challenging, and medication management is a key part of ensuring their comfort. Now we're going to take a few minutes to review how to manage medications and provide practical tips and tools to reduce stress and help you feel confident. You may ask yourself some questions such as, how do I know if the medication is working? You want to look for signs of relief, such as less pain, calmer breathing, reduced anxiety. What if my loved one refuses medication? This is common, especially as their condition declines. Talk with your hospice team about alternative forms, such as liquids, patches, or dissolvable tablets. Don't force medication. Remember, the goal is comfort. What should I do if I miss a dose? Medications given to relieve symptoms, also called comfort meds, are often given as needed rather than on a strict schedule. You may ask yourself, how can I make sure I'm giving medications safely? Keep a medication log to track times, doses, and effects. Set reminders using a phone alarm, an app, or a written schedule. What should I expect as death nears? It is common for appetite and swallowing to decrease as your loved one is closer to death, and some medications may be stopped. Your hospice team will guide you through these decisions. You may ask yourself what side effects may occur. The hospice team will teach you about side effects and how to handle those. Now let's address some common caregiver fears and myths. You may be afraid that you're going to overdose them. The reality is hospice medications are prescribed at safe levels. Overdose is unlikely when given as instructed. The goal is comfort, and the hospice team will help you to make sure that you're giving the doses that are needed. You may be worried that morphine will make them die faster. The reality is morphine does not shorten life. It helps ease pain and breathlessness, and proper pain control improves quality of life and may even extend it. Another is, how will I know when to stop giving medications? Your hospice team will guide you on when to stop any medications. Some medications, such as those for pain and anxiety and breathlessness, may continue until the very end. If swallowing becomes difficult, your hospice team can suggest alternative methods, liquids, under-the-tongue drops, or patches. Another common fear is, will they become addicted to pain medication? Addiction happens when someone takes a drug for a high, not for pain relief. When medications are used appropriately, addiction is not a concern. At the end of life, the priority is keeping them as comfortable as possible. And finally, here are a few practical tips and tools that might be helpful to you. Positioning. If swallowing is difficult, turn them to their side after giving medications by mouth. Raise their head slightly to help with swallowing and digestion. Medication schedules don't have to be strict. If they're sleeping comfortably, it's okay to delay a dose. Don't double up on doses unless your hospice team gives you instructions to do so. Keep a cheat sheet of medications. Write down what each one does, when to give it, and the common side effects to look for. Consider using medication tracking apps. These are really helpful, and they're available to help set reminders and track doses. Use a notebook or hospice-provided charts. Keeping written records can help you stay organized and can also help your communication with the hospice team. If you're ever unsure or you need support, please reach out to your care team. They are there to help you.